Hi everybody, it's Mitch Piskur with Armstrong and welcome to another segment of Business as Usual. Today we find ourselves in Ashland, Ohio, and we are at the Ashland County Health Department. And with me today is Vicki Taylor. Vicki is the Health Commissioner, so thanks for joining us, Vicki. Glad you could be here.
Thanks for having me.
I'm excited to be here. You're in a new facility now. I'm not sure how long it's been since you've been, maybe a year. Time's flying by so quickly, but talk about how long have you been in here and the advantages of this new facility compared to the old one especially.
Sure. So we moved here the end of June, just in 2023, so not quite a year yet.
Great.
Just a great facility. It's efficient. It's much larger. We're able to have all of our departments in one area and offer a lot more services because we have more room to do that. The other thing I think which great about it is that we are back in the center of the population for Ashland County. So we have noticed that more people are walking in on a consistent basis. I think you noticed our lobby when you came in today. That was pretty full with customers. And the community seems to be very happy that we're at a convenient location. So we're happy to be here to be able to serve Ashland community. So
that's great. And I know, my office is just behind your building. Right. And one thing I get to see, I see a van or a mobile clinic. Can you talk a little bit about that?
Sure. We got some great funding to be able to buy a mobile clinic for Ashland County. Part of the reason we did that is because we knew we were moving into the city, but we didn't want the outliers in Ashland County to feel like we didn't have services available for them. And so instead of trying to get everybody to come here, we decided to go to the public. And so our mobile clinic is scheduled in areas of Polk, Loudonville, Cinnamon Lake, and we try to get all across the county with our mobile clinic.
That way nobody's left out and you can go to them and they can meet you halfway or whatever. What a great service.
Absolutely, absolutely. So I think we've noticed it in the beginning was a little slow getting people to recognize it, but now we get a lot of feedback that says, "Hey, please come see us in our community."
Just that little bit of awareness, make people available. So that's good. That's
Absolutely.
A good thing. Health department, you folks are busy. You have a lot going on. What are in Ashland County right now? What are the biggest issues that you're dealing with right now, Vicki?
All right, so as you know, we have 4 departments, but the one that's probably the busiest and out in the community the most is our environmental health. They are the people that stay behind the scenes most of the time. So they do things like restaurant inspections, check out swimming pools, campgrounds, any places where public gathers, like schools, the jail, and just do a lot of inspections to make sure that the county is safe. That's what public health is about, kind of trying to get to the items before it happens. So that is one big area. We have a nursing department that does vaccinations. We do health screenings. And then we have the administration area that's where we do all the things like payroll, IT, grant funding, things like that to keep the operation running. Some of the biggest issues in our county right now that are ones that have us concerned are the areas such as colorectal cancer rates in Ashland County are higher than the national average. So now we're working with the hospital systems to find out why is that? What screenings could be available? How do we reach some of the underserved people in our community, right? A couple other issues, our suicide rates and our overdose rates last year were much higher than in previous years. So we have a committee that we meet every year and kind of go over that and find out what's at the source of this. What can we do as public health and what can we do as community partners to help our community stop this trend that's going on. So those are the areas that concern us right now.
Okay, great. As a fat man that likes to go out and eat, so I really appreciate the health inspections for restaurants. So
yes, I feel
confident.
The whole
community safe.
Yeah,
so
absolutely.
You folks do a great job with that. No,
Thank you.
A lot of great services that you offer, so we appreciate that. You serve the whole county, the whole community and all that. How many employees do you have, Vicki, to help take care of everybody?
Well, believe it or not, we have 17 employees right now. I feel like we could use a lot more. We're looking at more funding to increase that. But along with more funding usually means more grants, which means more work that we have to do. But I will tell you, our staff here loves being in public health. They're all here because it's a calling. We definitely appreciate the support and the kindness of our citizens in the county, but also our community partners. We work with all kinds of agencies, nonprofit agencies, social service agencies, governmental agencies, schools, the jail, everybody to kind of work together, police department, fire, to find out, what are you seeing out there and how can your information feed into programming that we do here.
Those relationships are so important. You help each other, feed off of each other, and
Absolutely.
help and learn and educate each other and help out. And all that's for the benefit of the community too.
Absolutely.
So really appreciate all that. Visiting your website, a ton of different services. Is there anything in particular that's kind of a new service that you started doing, or anything you're particularly proud of that you want to talk about?
Great question. When we acquired the mobile clinic, we decided to do some free screenings in the community. So we got some grant funding so that we could do blood pressure checks, weight and height checks, but we also do cholesterol, A1C checks, and mostly the basic screening tests so that people that don't have a doctor can get those screens and know where their numbers are. So that's new that we've added. What's not new, but what probably a lot of people don't understand, is that also public health has to be prepared for any kind of an event that could happen. So we do annual trainings, whether it's maybe an anthrax threat or radiological threat or pandemic, for instance. We have to train for those events. Not that you can ever be 100% trained, but I don't know if you noticed, but when the train derailment happened, public health had a big part in that as well, of setting up a clinic and checking citizens for their levels. So these are all things that we also do behind the scenes that I don't think the public understands is a part of public health. So
There's a lot there. I know there's a lot goes involved with it, and
Yes.
yourself and your whole group, you have to have that golden heart and that willing to serve and that desire to serve the community, which you folks do. You do such a great job.
Thank
You're so
you.
appreciated. Any other departments or any other services that you want to talk about?
Mostly, I think what happens is we look and see what's going on in our community and see where there might be a need for services, and then we try to find a way to fund it and make that happen. So it's great, like I said, to work closely with the hospitals, with both Ohio Health and University hospitals. We have great partnerships with them. We have a very supportive Board of Health that oversees us, and we just want to do what the community needs and what they see happening. So we reach out a lot, try to get focus groups to work with us. We send out surveys, customer service surveys, or even what are you seeing in your communities? Sometimes that's the best source of information for us.
You're here to serve, but if the community will reach out and participate in focus groups or send some information, send some questions, that will help you do a better job, at least know what the community need is. So definitely
Absolutely.
encourage everybody to take advantage of that invitation. That's a great service.
Thank you.
Your folks do a great job. We really appreciate what you do in the community. How long have you been here, Vicki?
I have been here 3 years.
3 years. Okay.
I started as the accreditation coordinator, and then we had a health commissioner leave, and the board approached me after some other interviews and said, we think you might be a good fit. So here I am. So
Good.
I live in Ashland. I've been here 25 years. I have family here. I have kids growing up here, grandkids growing up here. So this is home to me, and I want a safe and healthy community for my family as well as everybody
Since you're
else.
from here, this is your home. That makes
This
it a little
is
more
our home.
extra special than what you do. So
Absolutely.
I really appreciate that. So if somebody wants to reach out, phone number, website, what do you have you can share?
Okay, so we have our main phone line. It's 419-282-4231. And that's, we're open from 8 to 4 every day, but you can call after hours and leave messages. And our website is www.ashlandhealth.com. Feel free to send comments in. There's a contact us form right on our webpage that you can reach us at any time.
Great.
So,
Love what you guys do in the community. Such a great organization. Really appreciate you taking the time and sharing your story with us today.
Thank you.
Thanks for joining us. This has been Business as Usual. Please reach out and to the health department. They want your input. Give it to them, and they can do a better job. They do a great job for us in our community anyway, but just extra services they could do for us. So thanks for being
Yeah.
with us, Vicki.
Thank you. Thank you.
Our pleasure.